Thank you, Dr. Gust Bardy, for joining us today. Dr. Bardy is Professor of Medicine and retired from the University of Washington. And thank you for agreeing to speak with us to help the millions of arrhythmia patients around the world. Welcome.
Thank you. Pleasure to be here.
We have been inundated with questions from our patients and their loved ones. So can we start with some very basic questions, please? What is an arrhythmia? And why is it important to have our heart monitored?
Good question. So I've treated arrhythmia patients since 1980, and many of those people have serious problems and many have trivial problems. So an arrhythmia is essentially an irregular heart rhythm that's not your normal beat. And typically, they are minor. Sometimes they can be life-threatening on rare occasions. It is wise to always pay attention to them, especially as you age. People over 50 are more likely to have arrhythmias that require some sort of attention. That said, it can occur in very young people too, and especially in people who have other problems, some other heart problem, or problems with diabetes or high blood pressure, or sometimes congenital abnormalities of their electrical system of their heart. So there are a very large number of arrhythmias. Again, most of them are minor, but they all deserve some attention when they occur, if for nothing else, reassurance.
Thank you. And so it's important to have an EKG to be able to help the doctor understand what's happening with the rhythm of the heart?
Yes. Electrocardiograms are relatively easy to obtain. There are two basic categories. There is the brief spectrum of all electrical recordings of the heart while you're sitting still, and you can get multiple views of the electrical system of the heart. That's called a 12-lead electrocardiogram. It only records for 12 seconds, so it's not a long period of time, but what it does is give 12 electrical views of how the heart is conducting electricity. And from that, you can get important information. So having a standard electrocardiogram done is important, but recognize that it rarely identifies an arrhythmia. Arrhythmia in Greek means out of step with your rhythm. So a rhythm, normal rhythm, is usually picked up on a 12-lead electrocardiogram because arrhythmias don't occur commonly. They occur infrequently. And because of that, the complementary test is a longer-term recording that will pick up the signal over preferably days of time, not hours or minutes. So there are two basic tests to detect an arrhythmia. And as we age, like we get annual blood tests, for example, for cholesterol or diabetes, we probably, especially as we get into the 60s, should have annual tests of our heart rhythms as well.